Good morning, sir. This is Dakshayani from second BTech CSE A section. My topic for CAA2 assignment is social and economic impact of population growth. On this case study, explore the impact of population growth on hierarchical in Brazil. Population growth means population growth significantly affects both social and economic aspects of societies, and its impact varies depending on the factors like the rate of growth, regional development levels, and existing resources. Here is an overview of its major social and economic impacts. First of all, we should know about social impacts. Increased demand for public services, pressure on housing, environmental degradation, changes in social structure and culture. And last one is youth bulge and employment challenges. Increased demand for public services. With more people, there is a heightened demand for public services such as healthcare, education, transportation. Rapid population growth can strain these services, leading to overcrowded schools, hospitals, and transit systems, reducing the quality of services provided. Pressure on housing. As population density increases, so does the demand for housing. This can lead to housing shortages, overcrowding, and increased housing costs, particularly in urban areas. As a result, low income populations may be pushed into the informal settlements of slums with poor living conditions. Environmental degradation. More people means a greater demand for resources like water, food, and energy. High population growth can lead to deforestation, water surge, population, and loss of biodiversity as natural resources are overexploited to meet human needs. Changes in social structure and culture. The population growth can bring about shifts in family structure, employment patterns, and lifestyle choices, especially in urbanized areas. For instance, in some cultures, extended families may give way to nuclear families due to limited housing and economic pressure. And the last one is youth bulge and employment challenges. In many developing countries, a rapid population growth rate has led to young age structure for youth bulge. While this can mean a larger workforce, it can also present challenges in creating enough jobs, potentially leading to high youth unemployment and social unrest. Now we should move to economic impacts. The economic impacts are labor market expansion, economic growth potential, income inequality, increased pressure on resources, impact on government spending and debt. Labor market expansion. Population growth can increase the labor supply, which is which is beneficial for economic growth if there are sufficient jobs. However, if job creation doesn't keep pace with the labor supply, it can lead to high unemployment or underemployment, particularly in low skill sectors. Economic growth potential. A larger population can fuel economic growth as it increases consumer demand. With a large and youthful workforce, countries have the potential to drive productivity and innovation, especially when invest in education and infrastructure are made is harness this demographic advantage. Income inequality. Population growth can accelerate income inequality, particularly if economic gains are unevenly distributed without access to quality education, healthcare, and economic opportunities. Segments of the population may struggle, resulting in entrenched poverty. Increased pressure on resources. Rapid growth raises demand for resources like food, water, and energy. This can drive up cost, increase import dependencies, and lead to inflationary pressures in some regions, particularly if the country lacks sufficient natural resources. Impact on government spending and debt. Expanding populations require more significant government investments in infrastructure, healthcare, and social services. The countries with is fast growing populations may occur highest of public debt to find these essential services, potentially affecting long term facial stability. Balancing population growth with sustainable development. To maximize the positive effects of population growth, countries often focus on managing growth through policies that improves education, healthcare, and economic opportunity. Such strategies can transform population growth from a challenge into demographic dividend, where a larger, healthier, and educated workforce drives long-term economic development. However, these require a balanced approach that includes environmental protection, economic planning, and social policies that ensure all population growth benefit equitably. Now, case study. Explore the impact of population growth on healthcare in Brazil. Brazil experiences with population growth highlights the profound impact such growth can have on healthcare systems, particularly in a developing country with regional disparities. Over recent decades, Brazil population has grown substantially, bringing both challenges and progress in the healthcare sector. Here is an in-depth look at the effects of population growth on healthcare in Brazil. Strain on public healthcare resources. Brazil has a public funded healthcare system known as the Systematic Union Uni, Unico de Saúde SUS, which provides free healthcare to all citizens. With significant population growth, especially in urban areas, SUS has faced increasing demand. This pressure has resulted in overcrowded facilities, that is, major hospitals, particularly in densely populated urban areas like SAO, Sao Paulo, and Rio de Janeiro, experiences high patient loads, often leading to overcrowded emergency rooms and long waiting times for appointments. Shortages in medical personnel and resources. The healthcare system has struggled with shortage of doctors, nurses, and essential medical supplies, especially in undeserved regions and among vulnerable conditions. Rising healthcare costs. Brazil's healthcare budget has incremented address the needs of its growing population, but resources are remains a challenge, particularly given Brazil's economic fluctuality in medical sciences. And the second one is regional disparities in healthcare access, that is, urban versus rural areas access. Rapid urbanization has led to a concentration of healthcare resources in cities, leaving rural areas with limited access to quality healthcare. While urban centers have better equipped hospitals and more healthcare professionals, rural areas often lack basic services. Inequality access regions. Population growth has been uneven across Brazil's diverse regions. These northeastern and north regions, which have historically higher birth rates and higher poverty levels, face significant healthcare access challenges. These areas often lack advanced medical facilities and specialists, requiring patients in travel long distances for care. And the third one is increased demand for maternal and child health care. Population growth has led to a larger young demographic, driving a need for expanded material and child health services. This has to both direct and indirect impacts on healthcare. Higher demand for maternity and pediatric services. The Brazilian healthcare system has to accommodate a higher volume of births annually, leading to increased demand for parental and postnatal and pediatric services. Efforts to improve infant mortality. Brazil has made significant progress in reducing infant mortality rates through public health initiatives, vaccination programs, and parental care campaigns. However, disparities remain, especially in poorer regions where infant mortality is still higher than national average. And the fourth one is rising prevalence and non-communicable diseases. As Brazil's population grows and ages, there is an interesting prevalence of chronic diseases such as diabetes, hypertension, and heart diseases. This shift towards non-communicable diseases impact on mental health services. Brazil has also seen an increase in mental health issues, partly due to the pressure associated with rapid urbanization and socioeconomic disparities. Limited access to mental health services. Mental health services in Brazil are often insufficient with a limited number of facilities, such as mental health professionals, particularly in rural and undeserved areas. Public initiatives. The government has made efforts to imitate mental health into primary health care through community and the public health achievements and challenges. That is, immunization programs, progress in reducing poverty related diseases, economic constraints and health funding, that is, budget limitations. And this is the graph. Conclusion. Managing the healthcare impact of population growth. Brazil's experience illustrates the multi-faced impact of population growth on healthcare, highlighting the both achievements and ongoing challenges. While Brazil has made progress in expanding access to healthcare and improving the public health outcomes. Thank you.